Hi, so today I have a great pleasure to share this time with you guys and with my with our newest addition to Unpain Clinic team, Dr. Katarzyna Podolska. Hi. Thank you for accepting my invitation. To bring you here, and all we care and all we're trying to do here is just to put a light for people so they can understand a little bit more about their health and their body and see how we can actually help with our expertise and just to kind of to brainstorm. So if we brainstorm, people can actually pick and relate on things, and then we can help that way too, right?
Yes.
Yes. Okay. So Dr. Katarzyna, she is our naturopathic doctor at Unpain Clinic. And I want you actually to please help me understand this, because until you actually started with us, I had no idea what is the difference between a naturopath and naturopathic doctor.
Yeah, so a lot of people don't realize that there's a difference between the two, and there is. The term is often used interchangeably, but they're not the same thing. The difference is the education and the training. So naturopathic doctors are licensed healthcare professionals. A naturopath is not. A naturopathic doctor has to undergo licensing exams and board exams. A naturopath does not. A naturopathic doctor has to do continuing education every year. Naturopaths do not. A naturopathic doctor has to have an undergrad bachelor's degree. Naturopath does not. A naturopathic doctor has to have, I think it's 42, or the school that I attended anyway, over 4,200 hours of classroom and clinical training, as well as over 1,200 hours of actual supervised clinical experience. A naturopath does not have that. So,
wow.
Although many people think it's the same thing, it's not. The difference is the education and the training. Naturopathic doctors are also primary care providers.
Wow.
So they're actually able to diagnose and treat disease. A naturopath is not. Those are some of the main differences.
Wow. Well, honestly, that's why I asked you for this, because I had no clue. And I believe a lot in synchronicity. Like, I don't believe in coincidences, just even the way how we met and how you came on board, at Unpain Clinic. There was, a client of ours that he texted me and said, hey, there's a naturopathic doctor that you should bring it on board. And I said, but we never thought about it. And then after that text, I started thinking, hey, it's like, this is going to be amazing for Unpain Clinic and Unpain Clinic clients, because we treat a lot of muscle skeletal conditions, but we specifically target people that have been in pain for minimum 3 months and have tried everything else. And I'm talking now from my personal experience is when somebody comes with chronic lower back pain and like sciatica or herniated disc, and it's been there for a year or two, from MSK perspective, muscle skeletal perspective, to me, that's not anymore a muscle problem. There is way more into it. And that's where I know personally that that's a lot of gut issue, there's a lot of bowel inflammation. And that's why I said, yes, this is great to bring a naturopathic doctor so they can actually help in that journey, so we can actually make that client even better.
Yeah, because naturopathic medicine really looks at each individual holistically, right? So we take everything into consideration, and for us, everything is connected. And
yes. Human body is one single structure, right? I don't know who ended up dividing it, into pieces and treating as pieces, but if you just breathe through your mouth, that oxygen is going to go to your toe and to your hair and everywhere, right?
Yeah.
Yeah, that's awesome. So what made you actually pursue this career? How did you ended up becoming a naturopathic doctor?
Yeah. So, some personal information, I guess.
Yes.
I had a miscarriage in 2013,
Yeah.
and that sort of led to some health issues that I had. And, I was, all sorts of things were going on, and I
Yes.
was depressed. And of course, I went to go see conventional medicine doctors, and I was, given medication, and then I had side effects. And then I was giving another medication for the side effects of that first medication. And then I had side effects from the second medication. And then I was given a third medication for the side effects of the first and the second.
Yes.
And it was just this kind of moment where I realized, there has to be a better way. This can't be the best way to deal with all this. And I went to go see a naturopathic doctor here in Edmonton. And it's incredible. She changed my life with a few simple, lifestyle suggestions, some nutrients that I was missing, and some herbs.
Yes.
And she changed my life. And it was one of those moments where I was just like, wow, this is what I want to do. I want to be the person sitting on the other side of this desk.
Yes.
And I want to do for other people what she did for me. I want to, help them and treat them. And I want to change their lives like she changed mine. So that's kind of how it got started.
Wow. Well, thank you. Thank you for sharing that. And this is very powerful. Truly, this is powerful. But every time in life when we experience those, downsides or those circumstances or events, there's always kind of a good side on the other side of the coin. And it just wakes us up and kind of pushes us and it gives us the courage, to actually figure out things and do more and grow. And then you only understand when you look backward, when you measure backward and see it's like, okay, whatever happens in life, it has some kind of reason. And thank you for doing that, because I know you're going to help a lot of human, to feel better and change their life. And hopefully, trigger that thing where you push someone else to become a naturopathic doctor, right? Yeah. So, yeah, that's amazing. I want to actually, I saw you recently for an assessment, and I want to share kind of my personal story, because people will relate. I related, like, it was actually awakening for me, and was very powerful because we booked it for 90 minutes. So I came there, I filled out the form, and the questions that you asked just in the form, it was a moment of myself. It's like doing self-assessment. Hey, it's like, okay, actually I do this, I don't do this. So it was almost like awakening for me. It's like, hey, this is like, without even seeing her, it's making me think about my health, my day, my habits, my activities, and all that. And then, it was crazy. So then, like, we went through assessment. You asked me literally questions from pretty much from the time I was born, today and everything. And then you assessed me, like, listening to the heart rate, checking my, abdomen, like feeling everything. And then after that session, I thought, because I've seen, and again, I'm not against, don't get me wrong, medical doctor, everybody has their own place. We need everybody. We all have our unique abilities. But I was just thinking, if a medical doctor that I've seen personally, just for the regular checkup, if they only spend it like 20% of the time that you spend it, and if they do to every single person, where our healthcare system, would be. Anyway, I don't want to go in that rabbit hole, but can you just tell me a little bit, again, I told my personal experience, but why do you guys do that much assessment?
Yeah, so like I said before, naturopathic medicine really looks at treating the whole person. And more importantly, we look at the root cause of disease and illness. So in order to come to, conclusion about what is really going on in the body, what is causing this disease or what is causing these symptoms manifest, we have to go into detail about everything. And that's, your sleep, stress levels, your diet, your bowel movements.
Yes.
We have to talk about everything. and history. A lot of times, emotional trauma or physical trauma, our body holds on to that and it manifests in different ways. And so it's important to really get like a whole picture of
everything.
Basically,
Yes.
So we ask everything, from A to Z, and then it's also important to do that physical exam, right? To actually touch our patients, put our hands on our patients, and do a physical exam.
Yeah, honestly, I was very happy on top of that you you gave me the requisition to go and get some like blood work done for like thyroids, I think, cortisol levels, right? So the cortisol level is the hormone of stress, right? Or
yes.
Okay. What?
Yeah.
Okay. So what are you looking for from that? Like, what does that do to my body if the cortisol levels are high?
So I mean, that you brought up another point is naturopathic doctors in Alberta, we do have lab rights, so we can write requisitions and run tests. A lot of people are unaware of that, but that's a big part of what we do, because we can take a good history, we can have a pretty good idea of what's going on with someone, but until we actually run some blood work, check the blood or the urine or whatever we need to check, and get some actual physical numbers, that's our proof. Look, this is what's going on in the body, right?
Yeah.
So we we'll check all sorts of things. And sorry, your question was about
the cortisol. I haven't done I haven't seen the results yet. Like, we haven't got the results yet because first I have to go and do it. I'm a typical man where we wait and leave, procrastinate for a while. But I got the letter. Next week I'll bring the results. But I was actually thinking, because if there's one thing myself with everything that's happening, and I'm a very busy guy, so cortisol level, I think it's going to be high. So I want to kind of know, what does that do in human to human body? Like, what is cortisol in a way?
Yeah. Without going into too much details of exactly what we talked about, based on your sort of symptom picture and the things that you told me, I thought it was important to check your cortisol levels, because cortisol is, it's our stress hormone. It's going to affect how we feel, but it's going to also affect other things in our body, such as, might affect how we hold on to weight.
Yes.
Things like that.
Yes.
So,
yes.
There's several different reasons why I wanted to check that for exam a little bit.
That's awesome, because I want to share, my main concern is I'm super built in my extremities, but I actually have belly fat that I cannot kind of get rid of. And so before I even thought to go and push with exercise, to burn that, I wanted to understand personally why it's there in the first place, why I don't have the fat, on my extremities, but I'm holding it there. So that's why I want to kind of understand more of the cause. And then once I know that, I'm an active person, but even when I cycle and downhill ski, so the summer I do 100K, weekend when I go and cycle, and I still retain the belly fat.
Right.
So,
and there's several different reasons why a person might be holding on to excess weight, especially in the abdominal area. And it can be things such as, elevated cortisol levels due to sort of chronic low level or low grade stress.
yes.
It can be things such as diet or food sensitivities or allergies. It can be something like thyroid or thyroid hormones, which is another thing.
Yes.
And it can also be genetics. So there's several different reasons. And of course, lifestyle as well, right? So there's several different reasons. And running some tests, we'll be able to kind of narrow it down and try to figure out what's going on.
Yeah, honestly, this is the year that I'm looking forward, because with you, I'm doing now a lot of testing about my internal body and trying to understand myself from, genetic component to, again, food sensitivity to everything. So, because my goal, and I've shared this with everybody, my goal is to live to 126. If there's no accident, there's nothing, I want to live to there. So I'm still pretty young.
My goal is 100. I want to live to 100. So
awesome.
120. That's but I think you can do it.
If I have you till 100, I can push the 26. That's awesome. So, what is the most common kind of pattern that you guys see? If somebody, comes in and they have, like, let's say belly fat, but they have lack of energy, the sleep is bad, like where does everything start? Like, do you guys look at one system in particular first, or how does that typically work?
Yeah, so every sort of individual patient will be a complete unique story.
Okay.
We're taught to treat sort of the individual, right? So everybody's treatment is going to be completely different and tailored to their needs. So it's hard to kind of generalize and just say, because we really, and again, we try to look at the body holistically. So we're keeping, everything in mind, sort of mind, body, and spirit, while assessing someone.
Yes.
So sorry.
No problem. Wow. Awesome. So I remember we were just chatting briefly, I think a couple days ago at the clinic, and we were just brainstorming, and you were telling me about a genetic test that one of your clients had, right? So how you were able to determine what the person needed, in terms of like almost like a diet, food, and timing and everything. Are you comfortable sharing that with us here?
Yeah, I'll share a little bit. I mean,
Yes.
I'm definitely not an expert in this field,
Yeah.
but I'm learning and I'm self-studying, and it's something that really interests me, and I kind of want to get into more. So basically, these genetic tests, such as something like 23andMe,
Yes.
have become quite popular now, right? They're able to tell us some things about our ancestry, our background, where we come from, but they're also able to tell us some things about our health. Whether we are carriers for certain genetic diseases and cancers and things like that. But what some people don't know is, the report that they give you, there's actually so much more information we can sort of interpret from that genetic data. So we can take the raw data from something like 23andMe, for example, and we are able to interpret it, and we look at specific genes. And from that, we can tell you so much more. We can tell you, whether you are somebody who should be intermittent fasting, or whether you're somebody who should be eating, several small meals a day. We can tell you, whether you are somebody who, should be on a lower fat diet or a higher fat diet, depending on how your body stores it. We can tell you different vitamins, if your body is able to sort of metabolize and methylate them properly, whether, you're more at risk of missing certain enzymes for certain pathways. And based on that, we can actually tailor treatments, and we know, what would be good to sort of invest in, whether you're somebody who should be taking extra vitamin, B9, folic acid, because your body, it doesn't methylate it properly. So you should be taking, extra folic acid, and not just folic acid, but the form, methotetrahydrofolate, which is the methylated form of it, because that'll be easier for your body to sort of incorporate and use into the different pathways that it needs. So we can tell you so much more about your health based on these, this raw data from these genetic tests. Having to do with, is your money well spent on omega-3 supplements or vitamin D supplements, and all sorts of things like that.
Wow.
So yeah, it's quite fascinating.
Listening to you now is like, it makes me realize, because I kind of read things and learn that, this is good for you, this is good for you. So I have lots of supplements and vitamins and type of mushroom at home that I kind of take myself, and I realize that sometimes it's like they give me almost like a rash or temperature, so that might not be good for my body.
Right. So this is a way where, we're not just guessing this is what you need, or this will be good for you. We're actually looking at the data and saying, yes, you need more of this because your body doesn't absorb it well. So you should be supplementing, and this supplement, for example, you absorb it very well. So it might not be necessary to take it. Right? Yeah.
Well, because I know a lot of clients and lots of people nowadays, we hear something that this is good for something, and then everybody starts using it. And the same thing is, with diets. That's why personally I never believed in diets, because it's like, it's one technique, one schedule for a million people. And then you have people that, lose weight and then they gain more, or like they get more sick, or it just kind of changes their whole system. So,
yeah.
wow.
Yeah. We often hear, certain diets being heavily promoted, the keto diet, or, I don't know, there are all sorts of diets, right? But
Yes.
how do you know whether that diet is actually going to
Good
work
for you? Yes. Yeah.
So based on something like when I'm talking about the interpretation of the raw data, we can actually tell you whether, you're a person who's going to lose weight on a ketogenic diet, or maybe you're a person who's actually going to gain weight on a ketogenic diet.
Yes.
Yeah, one diet does not fit all, certainly.
Yes.
And we sort of now have the information to tailor, lifestyle and diet recommendations even better than before. So
true. And when it comes to losing weight, because we end up talking about this topic now, it's not what you see on the scale, right? It's like it's the fat, the muscle, percentage, and all that. There's way more component than just what you see on the scale. So wow. Honestly, I'm very happy that you're part of Unpain Clinic, and we're gonna be able to help people even more with you, and because of you, because when you came in, we had that conversation, we had a couple meetings, because that's how we do things. Like we look at more who you are as a person, your approach to everything, because any practitioner that we have, that's how we look at humans. Whether like you have a physio that is doing a treatment, or massage therapist, they look at every human as a one unit. So you were part of that, and I was surprised a little bit, and I was very happy at the same time that one of your kind of specialties that you want to kind of target mostly, it's skin, like skin conditions.
Yeah. So I have a passion, or a bit of an interest for skin health, sort of what I like to call naturopathic dermatology, and sort of medical aesthetics, what we can do in our scope of practice. And it's because, our skin, it's our first impression that we give people, right? It's the first thing people see. It is such an incredible it basically shows, our health on the inside, right? It's manifestation, what's going on our skin, of what's going on inside. And so it can tell us a lot about our health, and self-esteem, right? People have certain skin issues like acne, or eczema, or psoriasis, or rashes, or, the list goes on. That's the first thing people see. And women are often covering their skin up with makeup, and, people are self-conscious about it. So, I have an interest in skin and skin health, and I want to make people feel, as beautiful on the outside as they are on the inside, right?
Yeah, true. Yeah, it's like skin is the biggest organ in the body. That's the kind of, as you said, is the number one thing. If you're cold, it's your skin that is feeling it. If you're hot, it's your skin. So what is the like, why do people get acne typically, or eczema, or like what system is related to inside usually? If you can say anything about that.
Again, it's all connected. It can be something such as hormones, our endocrine system. Our hormones might be off. That's often with acne, especially sort of around the chin line.
Okay.
It can be something as simple as diet. Sometimes people have food sensitivities they're unaware of, and their skin is sort of breaking out, or forming rashes and things like that. It's basically trying to eliminate those toxins, or what's causing us to be sick on the inside. It can even be as simple as what we're putting on our skin topically, right?
Yes.
Cosmetics that we're using. There's so many different reasons.
So tell me this. So is with food, when you say food sensitivity, are you talking about like food allergy, or what is that?
Okay, so yes, there's food allergies and food sensitivities.
Okay.
Food allergies is basically what you think of, someone has a peanut allergy, they eat some peanuts and anaphylaxis, right? Their throat closes up and they swell up and they can't breathe. So that is a true allergy. When talking about that, it's the IgE antibody. With food sensitivities, we're talking about the IgG antibody. And these are the sort of delayed response kind of food reactions in our body. So these don't usually occur right away. They can occur from, several, minutes, half an hour after we eat, to even several days after we eat something, up to 3 days, I think is what they say. And these cause sort of more, I'm going to say mild, because it's not life-threatening right away, but they can cause symptoms such as headaches. They can cause, skin issues. They can cause digestive pain, bloating, gas, diarrhea, constipation. Yes. It can cause joint pain. It can cause, brain fog. It just, the list goes on. And and because of sort of the delayed response, you eat the food, say, I'll give you an example. For me, I have a dairy intolerance, a dairy sensitivity. So I'll eat dairy and right away I'm fine. But the next day, day 3, I suffer. I won't go into the details, but because of that sort of delayed response, sometimes it's hard to figure out what exactly is causing symptoms.
And our food nowadays are not simple. It's like you can eat something that has that ingredient, right?
Yes.
And then it can affect the system same way.
Yeah. So we can test for food sensitivities.
Okay.
It's also done through a blood test, and we run it through a private lab called Rocky Mountain Analytical.
Okay.
It takes a few weeks to get the information back, but when we do, it shows us exactly, which foods our body is reacting to.
Okay.
And which foods our body is not reacting to. And often, sometimes it doesn't have to do with the food itself, but sometimes it just has to do with, sorry, what am I trying to say? Like a leaky gut sort of situation.
Oh, I see.
Basically,
wow.
There's damage in our gut. And because of that damage and inflammation, our body is reacting to foods that it shouldn't react to, right?
Yes.
They're not really threatening, but our body is perceiving them as a threat and causing more inflammation in the body. And so sometimes it's as simple as removing these foods for a certain period of time, healing the gut using, different nutrients, herbs and things like that. And then we reintroduce these foods. And if we've healed the gut properly, sometimes we're able to eat these foods again, which is really nice. So it's a food sensitivity doesn't always mean forever, right? Our body is
changing.
Sometimes we'll reintroduce that food and our body still reacts. And unfortunately, it's just something we're going to always react to. But also knowing that, we can avoid those foods and avoid a lot of the unpleasant symptoms we might experience, right?
Yes. Okay, I have a question. So does this include kids too? I have 3 kids, so can I test my kids for food sensitivity, or is there a certain time in life, or?
Yeah, so children can be tested as well. I think, it'll sort of depend on the practitioner. I think most NDs usually don't like to test before age 5, unless it's really, really indicated and the child is, reacting to everything. And that just has to do with the development of our immune system.
I see.
So, before age 5, our immune system really still is developing, and we'll kind of get false results, because it'll show that we're reacting to things that maybe we're not. So it's sort of recommended, I think, after age 5, but it's really case-based. Sometimes it's necessary to run it on a younger child.
See, 5 years old, it's still, after 5 years old, or like even 10 or 15, it's still really good age, because if we can prevent, a disease or a problem or a dysfunction, it's way worth it than doing a reactive approach and going and trying to fix, because I know this from MSK component, like muscle skeletal. If one muscle gets injured, it's going to make the other muscle to compensate. And now we have two problems. And I have to go and fix initially, correct whatever caused the injury in the first place, and then come back and deal whatever was injured because of, that compensation. So I'm seeing, and especially with our clientele, I would say over 90% of our clients are more proactive, approach. So that's why we want to kind of expand and extend and just try to help more people in any way possible. Right. Yeah, that's awesome. That's awesome. I'm enjoying this conversation so much. And I hope all our listeners, or if you're watching in YouTube or you're listening in your car, I strongly believe we have just made people, think a little bit more, even one circle outside of the box more. Okay, so kind of a last question here, who you want to be hero to? Who do you want to, who is, I know that you want to heal everybody and help everybody, but who is that person that you want to help the most with?
Yeah, that's a tough question. I knew this was coming and I still feel unprepared for it.
I love this question because it's it really makes you think. It's a simple but very powerful question. And even though we want to help everybody with everything, it's you can't, right? So you have to be almost okay, this is kind of the this type of disease or this type of dysfunction, or whether you want to just help, somebody that just kind of it initiate the journey for them, or I don't know.
I guess I want to be a hero to anyone who might feel, that the conventional medicine system, perhaps has failed them. Yes. Anyone who, has ever been told, you're fine, but they don't feel fine, right? Yes. And then they sort of question and, what's going on? I don't feel fine, but my lab results are fine. And, everyone tells me I'm fine, but I don't feel fine. And, those are the people I would like to help. Anyone who, just struggles with kind of everyday digestive issues, people who, are holding on to excess weight, people who have struggled with, any kind of mood issues such as anxiety or depression or self-esteem issues. I think naturopathic medicine, has a lot to offer, all of those people. So,
yes. Well, yeah. Thank you. This is awesome. Thank you, because, again, you look at back where you started, the journey, everything that happened, all that schooling and all that. Now you're in this world for a reason. You have a mission to help those people. So I've been talking to every single client of mine about you because I see, indications that, again, you can help them. And even though they're experiencing just, lower back pain or neck or something, there's always more into it. And especially the time that we're going through. And again, I'm going to actually share this with you. It's a lot of lower back cases that I'm seeing recently. They're actually coming due to a lot of clenching from the jaw. So people are experiencing a lot of stress, and again, you listen to news, your lifestyle has changed completely, so you're grinding your teeth. And yes, I'm helping them from this physical, perspective, doing the shockwave, relaxing the muscles, offering that break. And then it's amazing, people, they don't want to get up from the table, they feel so relaxed, and that just a sign that the system was so tight constantly that it became the norm, for them. They thought that that's the way how you want to feel. But I can only do so much, with shockwave and from that aspect. So that's why I'm extremely happy. I cannot even express that, having you in here with us, where you can actually take them and help them figure out the internal body and, giving the supplements or right, herbs and everything to make their life better, because there is nothing more valuable than your health. It's like your body, it's your home. It's like you can have the best car, the best house, and best clothes and all that, but nothing matters. And I think a lot of people kind of realized this when COVID hit, right? And I'm sorry, I kind of took completely different direction, but this ties into everything. So for people that don't know me, I've been through the war in Kosovo as a kid. And one thing that I remember is my dad told us, it's like, if you see somebody killing me or us, you just run. Don't wait for anybody. So that tells you that in those circumstances and all that, you must be responsible for yourself. Whether it's health, whatever it is, it's you're responsible for your life. You're responsible for your body. It's if you wait for somebody you know that is going to passively help you, forget that. So for that reason, it's like there are all those tools available nowadays, that you can actually understand more, but you are the person, you're the best doctor, you're the best therapist. It's everybody here is just trying to assist you there. So there's no price in health, right?
Yeah. Health is everything. It really is. And it actually, when you were telling your story, it kind of reminds me of one of the principles of naturopathic medicine, which is doctor as teacher.
Yes.
And I love that, because I really believe it's our job to teach people and empower people to take control of their health, right? And to sort of strive for the best health they can achieve and be the best version of themselves that they can be. So,
Yes. Yeah. Well, I know we can go all day talking about everything, but I promise everybody that this is just our first session in brainstorming here and sharing all kinds of stories. So definitely we're going to do more of those meetings, virtual meetings, and where we can actually just share our experience and talks, just to help people in any way and any form we can. And then my vision, again, with you, Dr. Katarzyna, is to go through and probably pick, and dissect certain symptoms or problems. So look kind of forward to the next episodes.
Yes.
Okay, so thank you very much for coming in and sharing your time, your valuable time with us. So one last thing, like, how do people book with you? How do people get in touch with you? Like, what is the process like?
So you can go to the Unpain Clinic website, and there's a little book now kind of button you can click on there.
Yes.
You can click on me as a practitioner, and you can see the services that I offer, and of course my availability, and you can book online, or you can call the clinic and speak to reception, and they can help you from there.
So do people just like, is there any like one assessment, or like how do they determine like the first one?
Yeah, so if I've never seen you before, you'll be booking initial consultation, and those can range from 60 to 120 minutes. So I have 3 different consultations: a 60 minute, 90 minute, and 120 minutes. So typically, I would recommend a 90-minute appointment. This gives us enough time to do sort of a thorough history, any physical exams that we need, and write a requisition for any labs that need to be done. A 90-minute appointment is sort of just anyone coming in with just a couple health concerns.
Okay.
A 60-minute appointment would be someone who's coming in with no real health concerns. They just kind of want to, optimize their health, maybe see what else they could be doing. Maybe they want to come in and see if, a food sensitivity test might be right for them, or, there's various reasons, but it's essentially someone who doesn't have a lot of health concerns. And then the 120-minute appointment is for somebody coming in with kind of complex and chronic disease. So somebody who's coming in with, diabetes and hypertension and high cholesterol, and, the list goes on. So it takes a bit more work to kind of dive deep into the history and figure out what's going on.
That's awesome. Thank you again. Thank you for sharing everything.
Thank you so much for having me.
Yeah, my pleasure. Okay, we'll see you soon. Bye-bye.
Bye.